haven't let them. Paige, have you let people in? Because I'm not seeing attendees.
I
Our
am.
participant numbers are going up. Yeah.
Oh,
Yeah.
okay. I just can't see them. Weird. Okay, well, Paige, you'll have to watch for definitely for hands raised because I don't see them. Good morning. This is weird because I can't see people, so I feel a little disconcerted. So welcome to the public comment meeting on the naturopathic physician scope of practice sunrise review. I'm going to read a little script so I don't forget to kind of go over all the rules here. So first off, the meeting is being recorded. If you require captioning during the meeting and you hover at the bottom of the screen, there are some, there's a show captions option. You can just turn that on yourself. And that's where the raise hand function is as well during the meeting. And there's some instructions up on the screen too. First, I wanted to do a few introductions. We have a team of folks here, but I'll just do this really quickly so we have lots of time for public comments. I'm Sherry Thomas. I manage the Sunrise Review process at the Department of Health. And with me is my boss, Megan Veith, who is our Legislative Affairs Manager. I also have a few other folks here. One of my partners here, Paige, is running our Zoom meeting. And then we have a few other folks here who are going to kind of keep an eye on things and watch for any technical assistance folks may need. So as a reminder, Senator Cleveland asked the department to review the proposal that you've all seen to determine whether it meets the statutory criteria in Chapter 18-120 RCW to expand a profession scope of practice. So briefly, the proposal adds authority to prescribe Schedule 2 through 5 controlled substances, updates the definition of minor office procedures, and authorizes naturopathic physicians to sign forms like POST forms, disability determinations, and other types of forms. And then I wanted to share some information about how we'll run this meeting before we get into oral comments. I think we have about 120 folks registered for this, so we have a pretty good turnout here. And we had, last I looked, I think there's 56 scheduled to speak today. So this is to hear oral comments only. We've already collected over 1,100 written comments. So today's oral comments will supplement those for our review. We will do another written comment period after we share a draft report later in the spring. So the chat here is disabled. We won't be taking comments through the chat. We do have the Q&A function open, but we're asking that you only use that to alert us if you're having technical difficulties or you have questions about how the meeting is being run. So if you have questions about the Sunrise review process or the proposal in general, we have the sunrise@doh.wa.gov email box for that. And I think folks have been using that frequently already. So based on the number of folks and just making sure that we can do this within our 3-hour time frame, we're providing 2.5 minutes for comments. You can't give your allotted time to someone else to give them extra time. But if someone has already made your point, you can also just refer to their comments and say that you agree if you want to save time. We ask that you're respectful in your comments, and then keep your comments related to the proposal itself, the Sunrise criteria, and whether you support or oppose the proposal. So in short, that criteria says that it must demonstrate that this proposal meets the Sunrise criteria of protecting the public from harm and providing assurance of sufficient education, training, and ability to perform the updated scope. So I sent out a list Monday. It's grown a little bit with the order of how folks are registered to comment. So it should be pretty close to the number that you were listed. Let's see. Yeah, we have 56 folks signed up, as I said. So how we're going to do this, we're going to try this. I'm going to list the first 3 names right now. I'm going to do 3 names at a time so that folks can kind of get ready for your turn. And then when it's actually your turn, I'm going to ask you to please raise your hand so Paige can unmute you so that that will allow you to speak. So please don't raise your hand until I specifically call you for your turn. Because there are a number of folks who plan to log on later in the meeting, we're going to try to keep these instructions up and keep putting reminders so that folks that didn't hear the opening can kind of see how this will work. And we will have we've got a large timer that we're going to put up on screen. So once we unmute you and you see the timer pop up, we ask that you state your name and who you represent before beginning your comments. And please watch the timer on the screen closely because we really have to keep folks at this 2.5-minute mark to keep on schedule. So once that timer runs out, I'll say time's up and then we will mute folks so that we can keep going to the next folks in line. If someone isn't in the meeting when they're called, we did hear from a number of folks who are going to try to join, closer to when their time was. If they're not here though, we will, if time allows at the end of the meeting, we'll go ahead and call them again at the end and give them another opportunity to speak. And then we do plan to take a 5-minute break each hour. I've asked Megan to help try to remind me to do that so that, folks can have a break since this is kind of a lengthy meeting. Okay, I think unless Megan has anything to add, we should go ahead and get started. All right. So the first 3 folks that I have here, I've got Angela Ross, Kendra Dresner, and Joy Nauman. So Angela, if you can unmute or raise your hand so that we can unmute you and then you can get started.
Great. I think that I am here and unmuted.
You're good. Thank you.
Awesome. So good morning. I'm Dr. Angela Ross. I am a licensed naturopathic physician and the executive director of the Washington Association of Naturopathic Physicians. I am obviously here today speaking in support of our application. And I first just want to thank the department for its guidance throughout this process. I also really want to acknowledge the incredible outpouring of support from over 450 patients of naturopathic physicians during the written comment period. We honestly did not expect to see that many patients from our communities step up and get involved, and we are incredibly moved by just how many people wrote in to help really demonstrate the need for this expansion. I want to focus my comments today on how this scope expansion will actually help Washington in multiple ways. First and foremost, enabling us to work to the full extent of our training allows for better, safer, and more comprehensive care for the millions of patients who choose us as their preferred primary care providers. In addition, taking steps to clarify our scope and to ensure that it aligns with other statute-recognized primary healthcare practitioners enables better regulation of our profession and of our practice. Supporting this proposal means reducing the need for our regulatory board to try to interpret legislative intent. It means providing government agencies more clarity on the role of naturopathic physicians as they engage in rulemaking activities. And it does not change the existing facts that we are already subject to all aspects of the Uniform Disciplinary Act, requiring that we practice only to the extent of our competence and training and not beyond our personal limits, regardless of our legal scope. We are already required to register with and undergo monitoring by the DEA and the state through the Prescription Monitoring Program. And we are already regulated by a governor-appointed board that is overseen and supported by the Department of Health and the Attorney General's office, just like every other licensed primary healthcare practitioner in Washington state. There is a shortage of primary care services here. Patients struggle to find culturally respectful healthcare. The therapeutic relationship is key to supporting patients, and people are much more likely to follow recommendations made by the practitioners they trust. Supporting this application to align our scope with our existing training will improve all of these things. Thank you so much for your time.
Thank you. Perfect timing. Kendra Dresner, can you raise your hand, please, so we can unmute you?
Hi, my name is Kendra Dresner. I'm a licensed pharmacist here in Washington. As a clinical pharmacist, I see patients to help them manage their medications for a variety of conditions. I am here today in opposition to expanding naturopath's scope of practice because this proposal potentially endangers patient and public health. At times, my job involves helping patients sort through their prescription medications and potentially their dozens of naturopath prescribed remedies. These remedies are often scientifically unsupported and, even worse, may harmfully interact with the patient's prescription medications. This is unfortunately not surprising, as naturopaths have an insufficient background in pharmacology. They have completed only a small fraction of the hours of study required to develop a comprehensive understanding of pharmaceuticals. I am particularly concerned about allowing naturopaths to prescribe Schedule 2 through 5 substances. These are controlled for good reasons. Should we be increasing access to opioids when we are already fighting a crisis of opiate addiction in our country? Furthermore, some of these control medications can interact with each other, posing additional risks to patients. While we have a shortage of primary care physicians in Washington, naturopaths are not a substitute for science based medical providers. Here are just a couple of reasons. They have a documented antipathy toward vaccinations. Studies show reduced uptake of vaccines in children who see naturopaths. And previous statements by the Naturopath Board have been against COVID vaccination. Naturopathy, according to the Association of Accredited Naturopathic Medical Colleges, focuses on the body's ability to heal itself. However, this can result in delaying or eschewing needed treatments. A 2016 study found that breast cancer patients who seek alternative medicine treatments are 84% less likely to have received chemotherapy. A study from 2017 found that people with all kinds of cancer who use alternative treatments over traditional were more likely to die. Therefore, I urge the department to recommend against this bill. Thank you for your time.
Thank you very much. Next is Joy Nauman. Please raise your hand. Do we have Joy? Okay. And just a reminder, if folks have questions about the format of the meeting, please put it in the Q&A so that we can respond. Because we're only going to call on folks as they're listed in order. So just a reminder of that. So the next three that we're calling up are Laura Farr, Joanne Yanez, and Lauren Gresham. And Laura Farr, can you please raise your hand so that we can unmute you?
Hi, are we on live?
Yes, you are. Thank you.
Great, thank you. I am Laura Farr. I'm the Executive Director of the American Association of Naturopathic Physicians, here to provide insight on how other states address prescriptive authority for naturopathic doctors, obviously in support of this proposal. I testify in a lot of legislatures and meetings like this, often about prescribing, and it boggles my mind how many hours of time are burned refuting theoretical arguments about how allowing NDs to prescribe will harm public safety. The actual evidence does not support this at all, and you don't have to look very far to find it. I formerly was the executive director of the Oregon Association of Naturopathic Physicians. Oregon used to have a formulary for NDs that was restricted to only natural substances. And do you know what a natural substance is? Opioids. NDs in Oregon have been prescribing opioids safely for literally decades. In 2009, the legislature expanded the formulary to include all drugs needed in a primary care setting for the benefit of patients, including controlled substances in DEA Schedules 2 through 5. The Medical Society and the pharmacists in Oregon stayed neutral on that expansion because they knew that naturopathic doctors have a very safe track record of prescribing. When you look at the evidence, you'll actually find in a comparative analysis of disciplinary actions, specifically on prescribing patterns, there are more disciplinary actions in Oregon against NDs and DOs as a percentage of licensees than there are against naturopathic doctors. That is evidence. Here's more evidence. A study and letter of correction published in Pain magazine a few years ago uncovered that patients under ND care in Oregon who had adverse events related to opioid prescribing were seeing an average of 6 other medical providers concurrently. And the majority of high-risk prescribing that led to the adverse events was done by a conventional MD or DO, not by the ND. NDs actually tend to prescribe all pharmaceuticals very conservatively. Evidence. This is not about naturopathic education or residencies or competency or even concern for patient safety. This is purely about professional biases and the American Medical Association's campaign to stop scope expansion of all other healthcare professions. The evidence is that naturopathic doctors do prescribe controlled substances safely and have for decades.
Thank you. Thanks for your comments. We are now to Joanne Yanez. Can you raise your hand, please?
Can you hear me?
Yes, we can.
Wonderful. Thank you so much. My name is Dr. Joanne Yanez, Executive Director of the Association of Accredited Naturopathic Medical Colleges for the record. I am here regarding the WAMP proposal to expand scope of practice for NDs in Washington State as outlined in SB 5411. It seeks to modernize prescriptive authority, update defining language, and reflect changes in regulatory oversight. AANMC supports initiatives that increase work opportunities for our graduates, increase patient access, and best serve their patient population. As ED of the AANMC, I wish to highlight the comprehensive education and training that NDs do receive. Accreditation by definition means that a program is subject to oversight and regular review. CNME and institutionally accredited programs must teach to the broadest scope of practice. The opposition letters you've received make baseless claims this training is insufficient. We beg to differ. 1, based on decades of comparatively low malpractice rates and claims for primary care NDs, and 2, millions of safely and successfully treated patients. Further, opposition letters point toward medical school and residency as the minimum path to practice. Mid-level providers and NDs already practice across the country with our existing education. Wilk versus the AMA proved the culture of conspiracy to restrict trade by conventional medicine. There is a current AMA campaign to block all scope expansion across the U.S. Opposition has nothing to do with our education, however they try to convince you otherwise. ND programs have similar admissions prerequisites to other health professions, minus the MCAT, and use holistic admissions process that does not boil applicants down to a number. Holistic admissions improves diversity. Of note, AANMC convenes the Council of Deans who collaborate on academic issues, including publication of competencies and entrustable professional activities, which, similar to our conventional colleagues, guide uniform clinical assessment of ND students. Further, controlled substances are included in the curriculum as schools must teach to the broadest scope of practice. This underscores the readiness of naturopathic physicians to safely and responsibly prescribe controlled substances as outlined in this legislation. NDs are the only physicians consistently trained in this state to recognize drug, herb, and drug nutrient interactions. I appreciate you hearing our testimony, and on behalf of the association, I yield my time. Thank you.
Thank you. Next 3, I am calling up are Cabrin Chopek, Connor Waters, and Tanya Gren. Cabrin Chopek, can you please raise your hand so we can unmute you?
I think we missed Lauren.
Oh, I apologize. And Lauren, you have your hand up, so let's have Lauren be unmuted first. Thanks, Megan.
Yes, thank you. My name is Lauren Gresham. I am a naturopathic physician in the state of Washington. In the 1987 Wilk versus the AMA Supreme Court trial, the AMA was found guilty that it had engaged in unlawful conspiracy in the restraint of trade to contain and eliminate the chiropractic profession. The current territory wars against the naturopathic profession is the exact same behavior by the AMA to discredit and eliminate other legitimate medical fields, not to protect public safety. We literally have professors that teach at both the University of Washington School of Medicine and Bastyr and attest that they teach us the exact same material, but MDs refuse to believe this. We take a minimum of 2.5 years of graduate level pharmacology coursework. However, our training is most similar to nurse practitioners and other mid-level providers, a profession that also does not require residency training, but includes around 4+ years of graduate work. Mid-level providers are safely prescribing controlled substances throughout Washington, and expanding NDs serves the needs of patient access. Additionally, if we're unable to prescribe controlled substances, we are also not allowed to help take patients off of these medications, something that we are extremely equipped to do in our significantly longer patient encounters. An MD's visit is usually 7 to 15 minutes. Ours are usually around 45 to 60 minutes. Additionally, naturopaths have demonstrated safety and proficiency in states where we use these medications already, such as Arizona and Oregon. If the Department of Health is concerned about public safety, I strongly encourage the board to consider an additional board examination to demonstrate our proficiency with these medications, again, similar to how this is done in Oregon State. Patients are underserved without access to care. Random example, my sister moved here and it took her 10 months to be seen by a primary care physician. And she does need some controlled medicines for her healthcare. That is completely unacceptable. And for the record, that people will commonly say this whole vaccine thing. Patients select us because they have an idea that we're going to be opposed to vaccine. That is why statistically, more of our patients are unvaccinated. Bastyr University made a public statement in favor of the COVID vaccination. I personally advocated it for my patients. If you talk to most naturopaths, we are pro-science. I use UpToDate every single day in my clinical practice. So saying that we're not science-based, again, is more territory war and conspiracy against our profession, not for public safety. Please approve this bill.
Thank you very much. Thanks to everybody for staying on time too. It's really helpful. So now we're back to, and yes, and Cabrin, hopefully you can correct me on this, how to pronounce your name. We'll go ahead and unmute you now.
Hi there. So yes, I'm Dr. Cabran Chapik. I'm in support of this proposal. I'm a naturopathic physician who's been working in mental health care for the past 16 years. During this time, I've always worked in collaborative environments alongside psychiatrists and psychiatric nurse practitioners. I'd like to focus in particular on the area of stimulant prescribing, specifically as a public health need. By increasing naturopathic doctors' ability to prescribe would decrease the significant morbidity and mortality of untreated ADHD or attention deficit hyperactivity disorder in Washington state patients. According to the BMC Psychiatry Journal 2022, this was a prospective cohort study over 40 years. Childhood ADHD is associated with a twofold mortality risk by age 46. This risk was higher in young adulthood, and deaths were mostly attributed to unnatural causes like suicide and accidents. Young adults with childhood ADHD are at greater risk of premature death, which calls for preventive measures to be aimed at this age group. Therefore, anything limiting access to care and stimulant prescriptions will increase morbidity and mortality for Washington patients. ADHD is disabling if left untreated, not to mention undermining a child or adult self-esteem. I'm going to talk about a sample patient, a 10-year-old boy with untreated ADHD who his parents brought in for treatment because he was 3 years behind in his reading level. We tried various interventions on the naturopathic side, which helped, but just wasn't enough for him. When I referred him to a colleague for a stimulant prescription, he ended up getting Ritalin, which was able to help his reading and distractibility and performance in school. He was able to catch up after about a year on his reading level. The trajectory of his life was changed forever, not only academically, but his face was priceless, as he shone with pride when he told me how good he was doing in school now. He was able to get treatment. If patients go untreated, they have increased risk of morbidity and mortality. I refer 35 patients a year out for treatment, and then many more that need help outside of our clinic. which leaves many people untreated. Furthermore, medications do have a high potential for abuse and misuse, therefore caution is needed. However, the increased risk of substance use in patients, oh, sorry.
Thank you. Next up is Connor Waters. If you can raise your hand, we'll unmute you.
All right, there. All right, so hi, I'm Dr. Waters. I'm a second-year resident at the Ames Institute in Seattle. We're an integrated facility where I work alongside medical doctors, nurses, nurse practitioners, naturopathic doctors, counselors, psychologists, and mental health therapists. I myself am a licensed naturopathic doctor, a master's level Ayurveda practitioner, and a certified psychedelic assisted therapy provider through the Integrative Psychiatry Institute. So I'm here to talk about expanding this scope, which I'm clearly in favor of doing. And even in the integrated setting where I work, where resources are theoretically abundant, I encounter daily limitations due to the restrictive scope of practice for naturopathic doctors like myself. This is a clear indication that proximity to other providers with broader scopes does not solve the fundamental issues, and naturopaths themselves need this expanded scope. I'm currently, for example, unable to directly prescribe ketamine for my patients, and I am unable to prescribe psychostimulants for my patients. My practice focus is on integrative psychiatry, just to be clear. Now, ketamine has an evidence base that strongly supports its use in treatment for affective disorders like treatment-resistant depression, as well as substance abuse disorders, including those involving alcohol. In fact, a 2018 systematic review in the Frontiers in Psychiatry journal found that the results suggest that in this systematic review of 6 ongoing studies of ketamine in the treatment of alcohol, cocaine, cannabis, and opioid use disorders, that ketamine may facilitate abstinence across multiple substances of abuse and warrants broader investigation and addiction treatment. As well, my patients with ADHD must go to other providers at outside clinics, and it's frequently that I lose track of them, including military service members in the Army National Guard, including retired nurses, including tech workers, including so many people who I could much more directly help. So I am strongly in favor of this bill to streamline care for my patients and to really allow me to guarantee that my patients are receiving the care that they need. Thank you.
Thank you very much. Next up is Tanya Gren. If you can raise your hand, we'll unmute you. Doesn't look like we have Tanya Gren currently. Okay, I'm going to call up the next 3 then. Next up, we will have Kenneth Dietrich, Lana Ferris, and Jinda Chajinda. Kenneth Dietrich, if you can raise your hand, we will unmute you. You can go ahead and start, Kenneth Dietrich. Yep, there you go.
Okay.
Hi.
Can I start?
Yep, you're on.
Okay, thank you. Good morning. My name is Ken Dietrich. I'm a Chief Medical Officer at Summit Pacific Medical Center, and I've been with the institution for 8.5 years. I'm speaking in favor of this bill to expand the scope for naturopaths. At Summit Pacific, we were one of the first institutions in the state to hire naturopathic doctors into our primary care team. We have a very integrated model here, and for the last 7 years, we've had naturopathic doctors in our model, working alongside physicians, and nurse practitioners, and physician's assistants. When I was first asked to consider this, I was quite leery of it and did some serious investigation into the training of naturopathic physicians, and in particular, their pharmacological training. And I can say, looking at the coursework and the documents that I received from several institutions, that they have adequate and excessive training compared to nurse practitioners and PAs, and very similar to physician training around pharmacological therapy. But on a personal experience, our naturopathic doctors have proven to be equally proficient in providing care to all types of patients. At Summit, we have a program where we take random charts from all of our providers every quarter and send them out for outside review. And consistently, our naturopathic providers score in the top 25th percentile for diagnosis and treatment appropriately. I found them to be very scientifically oriented, and I'm concerned and actually a little bit dismayed at the pushback against naturopathic providers. The community and the patients want these patients, and I actually now have moved my care to a naturopathic provider to get the experience. This bill would not only help with their treatment, but also signing forms such as pulse forms and et cetera. And there is no scientific evidence at all that prescribing would increase the risk of narcotics, and our state has an adequate system of measuring controlled substance use, prescribing rules that are in place, and reporting tools. So I do not feel that the concern around narcotic expansion is one that's valid, and our state has, as I said, an adequate way to measure this. So I strongly encourage the support and expansion of this role, particularly in rural medicine. Thank you for your time.
Thank you. Next up is Lana Ferris. If you can raise your hand, we'll unmute you. Lana Ferris, are you here? No hands. How about Jinda Chajinda? Jinda Chajinda? Okay. Guess we will call the next three. So next three up are Cynthia Katarski, Christina Connor, and Luciano Garofalo. Cynthia Katarski, if you can raise your hand, we will unmute you.
Hi, can you hear me?
Yes.
Hi, my name is Dr. Cynthia Katarski. I am the medical director of Purpose Dignity Action in the co-lead program. I'm a primary care physician working with patients specifically living at the intersection of homelessness and substance use disorder in Seattle, specifically opioid use disorder. As all of you on this call are likely aware, we're currently experiencing a fentanyl epidemic in our state, and a key component to working with patients and overcoming this epidemic is removing barriers to access care. We have gold standard treatments in medications for opioid use disorder. Opioid agonist treatments such as buprenorphine work well. We have this researched, we have this studied. We know that this is a gold standard treatment for our patients. And in Washington state, our naturopathic physicians do not have access to this within our scope. And what this looks like in practicality is that we then have to refer our patients to another provider for this one specific medication in order for them to have treatment for opioid use disorder. Many of my patients report back that even when we can make this referral, that it is an unnecessary barrier to access care outside of their primary care physician, and that it reduces the likelihood for them to receive treatment. But sometimes appointments are booked out weeks or longer in order to access treatment. And unfortunately, it also promotes the further risks and perceptions and harms of stigma as their opioid use disorder being something other and different, requiring a level of care that their primary physician can't address, when in fact we are trained and readily and capable to treat this in our practices and do so in other states, as many on the call have already expressed. I want to point out something as well regarding buprenorphine. So when somebody experiences an overdose that is reversed by Narcan and naloxone, something that happens with my patients, this is a very unique time when we can initiate buprenorphine. And people are often very likely to
Can you finish
accept
your
it.
thought really quick, Cynthia?
Yes, it provides a 50% reduction in overdose risk for subsequent overdoses. So I ask that you please protect our most vulnerable population and update this scope of practice for naturopathic physicians. Thank you so much. I apologize for going over.
Thank you. Next up, Christina Connor, if you can raise your hand, we can unmute you.
Hello.
Hello.
Yeah. Hear me. Hi, I'm Christina Connor. I'm a naturopathic physician and Dean of the School of Naturopathic Medicine at Bastyr University. I support the proposal, and I'd like to highlight how naturopathic medical education supports the scope expansion. I'll focus on Bastyr's program, however, there are similarities between other accredited ND programs. As a naturopathic medical program, our responsibility is to ensure that our students become safe and effective practitioners. This starts with admission into the program, which requires a bachelor's degree, prerequisite courses, and a minimum undergraduate GPA of 3.0. Prerequisites must be suitable for pre-health professions. Through biomedical sciences such as anatomy and pathology, students learn how to diagnose and treat disease. Pharmacology is required, covering pharmacokinetics, therapeutic uses, adverse effects, and interactions. Our program prepares students to practice in any regulated jurisdiction. Since some states allow naturopathic physicians to prescribe controlled substances, these are already covered within the curriculum. During clinical training, even if medications are not prescribed by the supervising ND, we stress the safe use of therapeutics such as nutrients or botanical medicines alongside medications. We are trained to address drug, herb, and nutrient interactions. I'd like to close by explaining accreditation in higher education for those who may be unfamiliar with the process. Bastyr has regional accreditation with the Northwest Commission on Colleges and Universities, which permits us to grant degrees and evaluates the entire university. Accreditation for naturopathic medical programs is through the Council of Naturopathic Medical Education. Our ND program has been continuously accredited by the CNME since 1987. The CNME is recognized by the Department of Education to accredit naturopathic medical programs only, and it is the sole organization that may do so. Naturopathic medical programs cannot apply for accreditation with a different programmatic accreditor, just as the dental or nursing program can't apply for accreditation through the CNME. Accreditation of naturopathic medical programs is no different than the process for other health professions. Thank you for the opportunity to speak today.
Thank you. Next up is Luciano Garofalo. If you can raise your hand, we will unmute you.
Great. Can you hear me?
Yes, we can.
Cool. My name is Luciano Garofalo. I'm a naturopathic doctor, and I support the proposed scope expansion with the provision of interdisciplinary board oversight. I practice general pediatrics at a nonprofit clinic in Tacoma, which is a VFC site, and I'm certified by the Healthcare Authority as a Center of Excellence in Autism. I also hold an affiliate faculty appointment in the University of Washington School of Public Health, and I completed a 3-year NIH research fellowship at the UW prior to that. We have colleagues who work in academic medical centers and federally qualified health centers. Naturopathic medical training and the quality of our graduates has continuously improved over the past 2 decades, thanks to more opportunities across healthcare. There is nothing inherent to our identity or abilities that makes us incapable of safely prescribing Schedule 2 through 5 drugs or performing minor surgery. Naturopaths in Oregon have had the scope of practice outlined in this proposal for over a decade. It was referenced earlier, but a study published in 2018 by Fink and colleagues compared opioid prescribing practices across all provider types in Oregon from 2011 to 2014. There was no significant difference between naturopathic and medical doctors in the rate of opioid prescriptions that led to hospitalization, and there were no deaths related to opioid prescriptions from naturopathic doctors at all during the study period. Osteopaths, nurse practitioners, and physician assistants have all faced the same arguments against scope expansion that our colleagues in the AMA bring to this proposal. Holding naturopathic doctors at the margins of healthcare is a disservice to the public. I'm in the South Puget Sound region, and there's currently a 4 to 6 month wait or more just for a primary care visit. Specialties like psychiatry and dermatology can be even worse, and most are close to Medicaid. We have patients in our practice who have relapsed into drug use and been hospitalized and kicked out of school because they couldn't access the treatment they need. The board has a clear opportunity to help our patients with this proposal. We cannot adequately serve as primary care providers without a broader scope of practice. So again, to restate, I'm in favor of the scope expansion. We participate in the PDMP. It's been very well demonstrated that we can serve in this scope, and it's a disservice to the state to continue us to bar us out. I yield the rest of my time. Thank you.
Thank you. And just a reminder for folks who may have joined late, I am listing 3 names at a time just to get folks kind of queued up for their turn. And when it's your turn, I call your name and ask you to raise your hand because that gives us the ability to unmute you. And then once unmuted, we'll start the timer, and please state your name, who you represent for the record, and we're providing 2.5 minutes per comment. Once the timer runs out, we'll alert you, and we will mute you if we need to, just to keep us on time. So please watch the timer on the screen really closely. So next up, we have Katerina Lamarche, Kim Morissette, and Michael Manning. So Katerina Lamarche, if you could raise your hand. Well, yep, thank you. We'll unmute you.
Great, thank you. My name is Katerina Lamarche. I'm commenting on behalf of the Washington State Hospital Association in opposition to the proposed scope expansion. Historically, we have often remained neutral on scope expansion, but this proposal, we believe, rises to a level of concern that warrants our engagement. We are concerned that the proposed scope expansion will result in more patients needing specialty and hospital services. Hospitals already report treating unnecessary worsening of primary care conditions due to naturopathic mismanagement. This is often seen in patients with chronic conditions like diabetes. We'd also like to note that naturopaths who practice independently really can't be compared to hospital-employed naturopaths who work in an integrated team-based care model with physicians and other allopathic and osteopathic providers. Additionally, the competency of independent or hospital-employed naturopaths to work safely within their current scope really can't be used to justify increased expansion. Increased expansion really should be supported by commensurate education and training. The proposal, however, does not adequately demonstrate that naturopaths receive commensurate education and training, and the department should not recommend in favor of this proposal. Thank you for the opportunity to comment.
Thank you. Next up, Kim Morissette, if you could raise your hand, we'll unmute you.
Hi, my name is Dr. Kim Morissette. I'm an emergency physician and the Swedish System Chief of Staff, and I oppose this proposal for expanding the scope of expansion of naturopaths. Thank you for the opportunity to provide this feedback on this important topic. In my years of work on quality improvement in patient care, I'm acutely aware of the potential for medical errors that can occur in the absence of adequate training and supervision. Physicians need years of supervised training to become competent to perform procedures and prescribe scheduled medications safely. MD and DO physicians receive 12,000 to 17,000 hours of supervised training after graduating medical school. This allows them the opportunity to gain skills needed to not just perform procedures, but also manage complications if they arise. There's no requirement for postgraduate supervised residency training for naturopaths, and there is only 1,200 hours of clinical observation training in naturopathic school. Routinely in the emergency department, I meet a patient who receives primary care from a naturopathic doctor. The patient believes that they are receiving the same high quality care from their naturopath as they would from an MD or a DO. The patients lack the ability and of the understanding of what the difference in the training is. Therefore, our state has a duty to protect patients by not increasing the scope of practice for naturopaths where they lack the supervision and training. This proposal updates to minor office procedure provisions within the Naturopathic Practice Act to include primary care services is vague and allows for a number of interpretations without ensuring adequate education and training is provided. Patient safety and high quality care should be paramount to any decision the state is considering. Changing the naturopathic scope of practice to include procedures such as vasectomies and surgical abortions as office procedures is fraught with concern for the safety of patients, as naturopaths do not have the training or supervision to perform these life-altering procedures or handle complications. If our naturopathic colleagues wish to prescribe scheduled medications and perform minor office procedures, then they should, at minimum, receive the same education and experience as MD or DO colleagues prior to licensure. Please, for patient safety, do not approve the Sunrise Review proposal to increase the scope of practice of naturopaths pursuant to Senate Bill 5411. Thank you.
Thank you. Next up is Michael Manning. If you can raise your hand so we can unmute you.
Hello there.
Hello. You
Hi,
can-
good morning. I am in support of expanding scope of practice for naturopathic physicians in Washington. My name is Dr. Michael Manning. I'm a licensed naturopathic physician working as a first-year resident, practicing primary care, family medicine, and working towards a naturopathic pediatric board certification. So much of the pushback regarding scope expansion regards concern for patient safety under suspicion that licensed naturopathic physicians are not adequately trained to provide higher level care. As a recent graduate, I can express confidently that we are well educated and well trained and often receive more education and training in many aspects of basic science and clinical practice in the primary care setting than our nurse practitioner and physician assistant colleagues, who are brilliant and valuable, but who, despite that lack of education and training, have clearly larger scopes of practice. We spend a lot of time in Washington State and our country talking about the lack of access of care and hoops patients have to jump through regarding coordination of care, when the work could be done with fewer providers and less coordination of care with expanded scope. I do not have the same level of professional clinical experience as most of the people present here today with us. While I've only been practicing primary care family medicine for 6 months, I can assure you that from my work now, my time as an EMT, working in hospital settings regarding dietetics, and my time as a naturopathic student clinician for half a decade prior, that our communities are struggling. We do not need to place more barriers on them because most of the medical and legal community are not aware of the levels of education and training we receive, and who rather rely on anecdotes. Despite it not being required of our nurse practitioner and physician assistant colleagues, I am for a required residency after school as one possible path forward for those naturopathic physicians who want to expand their scope. This may also include extra pharmacology exam, other proficiency exams, including steps toward an expanded DEA license. There are many steps in our state and country that we can take to improving access to medical care. Let expanding the scope for naturopathic physicians in Washington State be one of them.
Thank you. Next three up will be Scott Hippie, Kelsey Klausmeyer, and Chris Kotner. So if Scott Hippie can please raise your hand, we will unmute you.
Hello, can you hear me?
We can.
Great. Hello, I'm Scott Hippie. Thank you for taking time to hear public comment on this important topic. I'm a member of the Washington Academy of Family Physicians and serve on their board of directors. Along with the WAFP as a whole, I testify in opposition to the proposed scope expansion. I'm a board certified family physician and I practice in Central Washington. In order to practice competently and safely, I've dedicated my life to medicine now for over a decade. 4 years of medical school were just the start, followed by another intense 4-year period of residency and fellowship training. During that time, I worked up to 80 hours per week or more, providing direct patient care alongside knowledgeable supervising physicians. In this apprenticeship model, I learned so much about taking care of sick people. Importantly, I also learned about risk, about how things can go wrong, about how to know the limits of my own knowledge and abilities. As a physician, it is just as important to know your stuff as it is to know when you are out of your depth and need to ask for help. Naturopathic physicians can help the health of our population, but as far as prescribing Schedule II medications, they would be far out of their depth. Naturopaths receive minimal specific training in prescribing pharmaceuticals during their schooling and do not have residency to develop skills prescribing controlled medications in a safe and supervised manner. Opiates, benzodiazepines, and amphetamines are dangerous. They can addict, harm, and kill. I fear that the citizens of Washington will be harmed if the proposal in question were to be enacted. My fears are rooted in real-world clinical experience. Washington granted naturopathic physicians prescriptive authority over testosterone in 2005. As a hormone, testosterone can have many and far-reaching effects. It can increase the risk of cancer, heart attack, and stroke. A testosterone prescription requires an established deficiency, careful monitoring, and a discussion of risks, benefits, and alternatives with the patient. In my practice, I've encountered many individuals placed on testosterone by their naturopathic doctor without ever having demonstrated a low level to begin with. They're prescribed large doses for years without having levels monitored. They have not been monitored for complications. I've seen too many naturopaths disregard scientifically based guidelines regarding prescribing testosterone, and I fear the same would be true for the Schedule II medications in question. I grant that the request to expand scope of naturopathic practice comes from a well-intentioned place. We have an impending crisis of workforce in healthcare and must think of creative ways to address it. I did not take up opposition lightly, but because of what I've seen in real life, I encourage the Department of Health to oppose this measure to expand the prescriptive authority. Thank you. I yield the rest of my time.
Thank you. Kelsey Klausmeyer, if you raise your hand, we can unmute you.
Oh, next, sure. Okay, thank you, Department of Health, for inviting public comment. I'm Kelsey Klausmeyer. I am a licensed naturopathic physician with a primary care practice located on the Swedish Cherry Hill campus in Seattle. I'm testifying today in support of the expanded scope and want to focus my comments on patients whose well-being is the focus of this legislation. Specifically, I'd like to share the story of a patient who really needed my help, and I was unable to properly support him due to the limitation of scope. This young man, 19 years old, had been my patient for the past couple of years. We had built a lot of trust during that time as I got to know him and his struggles with depression and anxiety. He was established with a therapist and his family provided a lot of support. Despite these efforts, the pandemic hit him hard. The social isolation heightened his struggles. He came to see me one day in a state of total panic. He was late for the appointment because he had such difficulty coming into the office. I can only imagine the great amount of trust and strength it took on his part to show up that day. This young man absolutely needed medication that was out of my scope of practice. He had already exhausted other non-pharmacological interventions, and I encouraged him to go to the emergency room, which is on the very same medical campus where I work. Even with this close proximity, even with me offering to walk him there and advocate for him, he was terrified to go and pushed back, saying that he had been to the emergency room previously and that they didn't help. They didn't know him and thought he was a drug seeker. I tried to reassure him that it would be different this time. During our conversation, he never made suicidal statements and denied any suicidal ideation. Unfortunately, I found out just a few weeks later by his parents that he had committed suicide. I truly believe that intervening with medication, being more integrated into the healthcare system, that this patient could have had a different outcome to his story. And I asked the Department of Health to please support this increased scope for naturopathic physicians. Thank you, and I'll yield my time.
Thank you. Chris Kottner, if you raise your hand, we will unmute you.
My hand's raised.
You're unmuted. You're ready. You're good to go.
Oh, okay. Good morning. Thank you. My name is Chris Kottner. I'm a naturopathic physician, and I've been practicing in the field of psychiatry for over 20 years. Given that, I'm definitely in support of the expansion of our scope. Like some of my colleagues, I've also worked in a group in which I'm working alongside many different types of clinicians, and I've never been viewed as someone that's untrained, unskilled, unsafe, or inadequate in any way. In fact, it's often very positive, collaborative care in which oftentimes, even with MDs or other psychiatrists or nurse practitioners, my advice is even sought after because of my clinical experience. And this is what I've delved into and trust that the education I got at Bastyr, along with the continuing education that I continue to get, which is key for all physicians. None of us, I don't think, are relying just on what we learned in medical school or residency. Things are continuing to change, and we have to continue to be safe through educating ourselves. Of course, there's multiple different ways in which we can reference now drug-drug interactions, drug-herb interactions, look in different manuals written by experts for a particular controlled substance that has been peer reviewed. So we're keeping our prescribing information accurate and safe, and then also monitoring it appropriately so you have the best outcome for the patient. I just wanted to think about, because there's already been so many truths stated in support of our scope, I wanted to think about, what does a safe prescriber of controlled substances look like? And I believe it would be someone that once an accurate diagnosis is made, they're able to access the PMP, they're able to prescribe the right medicine, they'll be able to reference things appropriately so that they know they're following through what would be safe and appropriate for that patient, and then monitoring it well. Thank you very much for your time. I'm very confident that naturopathic physicians will be able to manage an increased scope of prescription authority with safety and confidence to the betterment of the patients in the state of Washington. Thank you.
Thank you. So I was just reminded that I promised a break each hour, and it's almost 10 o'clock. So it's a good time let's take just a 5-minute break, and everybody be back here by 10:01, or yes, 10:01, please. Okay, hopefully that was a good enough break for folks so we can keep moving along. Welcome back. I wanted to just do a quick verbal reminder again about, for folks who may have joined late, that I am listing three names at a time, so you have a heads up when your time is coming. When it's your turn, I'll call your name and ask you to raise your hand so that we can unmute you. Once we unmute you and start the timer, we ask that you state your name and who you represent for the record, and we'll give you a 2.5-minute time limit. Once the timer runs out, we will give you we will alert you verbally if you're still speaking, and then we will mute you just to keep us on track. So please watch that timer closely. That will be up on the screen in just a minute. And the next three I will call are Hannah Gordon, Tressa Pinkleton, and Waji Kasten. Hannah Gordon, can you please raise your hand so we can unmute you?
Can you hear me now?
We can.
Okay, great, thank you. All right, thank you for having me today. I am commenting in support of scope expansion and will be focusing on curriculum comparison. My name is Hannah Gordon, and my background includes a Bachelor of Science in Nursing and Pre-Med, a 4-year acute care, 4 years of acute care registered nurse, a 4-year residential naturopathic doctoral program, followed by a 1-year naturopathic residency. I am part of the executive leadership team for the Naturopathic Academy of Primary Care Physicians, which focuses on continuing education for NDPCPs, of which also includes statements endorsing vaccines. I am currently the assistant medical director of a federally qualified health center in Seattle, Washington, where I oversee medical doctors, nurse practitioners, and physician assistants. I have practiced in hospitals as a nurse, as a provider in primary care and urgent care settings. Due to hiring restrictions based on the limiting prescribing scope and lack of Medicare coverage for naturopathic doctors, I obtained a nurse practitioner degree through a virtual program, not including in-person rotations. This additional degree was not medically necessary based on training, but was practically necessary based on existing limitations on my naturopathic scope of practice. My next statements around curriculum comparison are to illustrate a potential area of bias towards naturopathic doctors and not to diminish the asset of inclusion of nurse practitioners into the medical system at large, of which I am now one. During my nurse practitioner program, I had 1 class of pharmacology, which included multiple subjects each week. We did not cover controlled substances beyond a required 24-hour external buprenorphine training, and we're instructed to update ourselves on our own state requirements for prescribing. Again, there was no education around opioid prescribing or controlled substances, especially even morphine equivalents. Having successfully completed both academic programs and met the conditions of licensure in both fields, it seems odd that my legal prescribing authority is much broader under my nurse practitioner license than under my naturopathic doctor license. Expansion of scope and prescribing rights for naturopathic doctors will decrease the primary care shortage by easing the hiring restrictions based on limited scope. Organizations like University of Washington, Fred Hutch, Seattle Children's, HealthPoint are credentialing NDs to be part of the medical team. And I'll wrap up. I ask the Department of Health to recognize the full benefit of naturopathic doctors by supporting this reasonable and well-supported request for scope expansion to provide comprehensive primary care services. Thank you.
Thank you. Tressa Pinkleton, can you please raise your hand so we can unmute you? Tressa Pinkleton, are you here? Don't see a hand, so let's move on to Waji Kasten, please.
Hello.
Hello, we can hear you.
Great. My name is Waji Kasten. I'm a naturopathic physician and licensed acupuncturist that has worked for the Lower Elbow Column tribe as a primary care provider since 2016. I'm also a Bloomberg Fellow at Johns Hopkins University, completing my master's in public health with a focus in addiction and overdose. I am in support of expanding the scope of naturopathic medicine in Washington state to include Schedule 2 to 5 drugs, which aligns with other mid-level practitioners, such as nurse practitioners and physician's assistants. The naturopathic medical school curriculum, pharmacology and instruction, and continuing education requirements, including the 8-hour and medications for opioid use disorder requirement by the DEA, provides a foundation to safely prescribe controlled substances. Like most Americans, I see the effects of overprescription of opioids on a regular basis. As a medical provider and public health student in a rural, underserved area that works for a tribe, I recognize that there is a need for increased access to medications for opioid use disorder, such as buprenorphine. The removal of the Drug Addiction Treatment Act of 2000, the X waiver, in December 2022 dramatically increased the number of medical professionals who can prescribe buprenorphine. Unfortunately, this has not been enough, and fatal drug overdoses rose to over 110,000 deaths in 2023. Expansion of prescription authority for naturopathic physicians will help increase access to treatment with the gold standard for opioid use disorder, buprenorphine. I recently attended a webinar put on by the Washington State Hospital Association, and I learned that there are many guardrails, such as the Prescription Drug Monitoring Program, public health campaigns about safer prescribing, and drug take-back programs that support providers when they prescribe opioids, affirming that there are systems in place to protect the public. I am Dene Soulane, a Canadian First Nations woman that chose to become a naturopathic physician because I wanted to provide culturally safe care to other Indigenous people. I've had the privilege of working for a tribe and providing culturally appropriate care for Native people on the Olympic Peninsula for the past 8 years. I live and work in Clallam County, a rural county that has one of the highest rates of drug overdoses in Washington State. Indigenous people in Washington State are dying at a higher rate than all other racial ethnic groups because of drug overdoses. Expansion of naturopathic physicians' prescriptive authority will allow increased access to life-saving medication and help prevent further loss of life and promote health equity for our Washington tribal communities. Thank you.
Thank you. Next three are Tracy Pantuso, Katie Bassett, and Jeffrey Frankel. Tracy Pantuso, can you please raise your hand so we can unmute you? There you go.
Can you hear me?
We can.
Hi, my name is Tracy Pantuso. I'm a graduate of the Naturopathic Doctoral and Clinical Residency programs at Bastyr University. I've also earned a master's degree in biology. I've spent the last 23 years in the fields of integrative and naturopathic medicine and natural products research. As a researcher, former adjunct faculty member, I'm very concerned about this proposal to increase scope as written. There are a small number of NDs and their patients that would benefit from the increase in prescriptive rights. However, I oppose this bill as written as I am concerned for patient welfare. To be able to increase prescriptive rights to include Schedules 2 through 5 would require increases in CE and changes to the naturopathic education. As the AMA and the Washington State Medical Association have stated in their written comments, I too am also concerned about the behavior of the Board of Naturopathy over the last few years. Included in the written comments is an article that my colleague Dr. Shannon Hurst and I wrote explaining the issue. However, there is a much larger conflict of interest issue that has not been discussed, and that is the financial situation of ND graduates, which may impact prescribing practices. The Federal College Scorecard data demonstrates that graduates from CNME accredited naturopathic doctoral schools have some of the highest debt-to-income ratios for graduates out of the 6,371 graduate programs included. ND programs from National University of Natural Medicine in Portland and Bastyr University occupy the top 2 worst positions nationally. Based on this federal data, at 4 years after graduation and an overall average debt-to-income ratio of 585%, naturopathic doctorate grads are less able to pay their student loans than doctoral first professional grads in any field of study. In comparison, medical doctors have a debt-to-income ratio of 204% at the same time point, and many are still in postgraduate training and have many more opportunities to receive loan forgiveness through federal programs such as PSLF. In fact, ND graduates make the same or less than before attending ND school, with Bastyr graduates having accrued a median debt of $300,530 and are making $3,642 per month with a loan payment of $3,419, which is why most ND grads with student loans are on income-based repayment plans. This level of debt with such low earnings should be taken into consideration when voting for this bill. Thank you.
Thank you for your comments. Next three are Nancy Conley, Jean Hung, and Justin Stamshore. Nancy Conley, if you can raise your hand, we'll unmute you. I apologize. I'm queuing up people before I called the next couple of people. So that was Katie, I believe. So next up would be Jeffrey Frankel. If you can unmute yourself, please. So, or raise your hand so we can unmute you.
I think we missed Katie, actually. That was Tracy. So I think Katie's up next.
I apologize. I got really off track here somehow. Katie Bassett, are you here? Thank you so much.
Hi, I'm Katie Bassett. I'm a dermatologist and I'm the president of the Washington State Dermatology Association. I also train family medicine residents in their dermatology rotations. I am opposed to the proposed expansion allowing NDs to perform minor office procedures. Dermatologists are experts in in-office procedures like freezing precancerous lesions, biopsying suspicious lesions, and cutting out skin cancers. Board certification requires 4 years of medical school and an additional 4 years of residency, during which we have years to practice the procedures that we perform every day. Perhaps an even greater skill is to know what makes a suspicious lesion suspicious enough to perform the procedure in the first place. Think of an outdoor field of grasses and flowers. Out of all of the plants, could you tell which are the native plants and which are the weeds? You probably could, but it would take a lot of practice. Dermatologists can look at the back with 100 dark skin lesions and, using our tools and training, find the melanoma. Primary doctors complete a required dermatology rotation as part of their residency. They have just enough knowledge to know what they don't know and to refer when appropriate. Physician assistants and nurse practitioners who are employed in dermatology offices across Washington State not only receive direct training, they also receive continued supervision by board-certified dermatologists who are responsible if something goes wrong. Naturopaths have no such institutional knowledge of dermatologic in-office procedures, let alone the training to know how to use those procedures to improve the health of the patient. Allowing naturopaths to perform in-office procedures would result in patients getting unnecessary procedures. It will also increase the cost to our healthcare system without improving patient care. Deadly melanomas will be missed and diagnoses will be delayed because patients put their trust in a provider who is not properly trained to evaluate their skin or choose the appropriate procedure. I encourage the Department of Health to say no to expanding naturopath scope of practice for in-office procedures. Thank you.
Thank you. So now we've got Jeffrey Frankel. You are up if you want to raise your hand. Jeffrey Frankel, are you here? There you are. You're good to go.
Okay, thank you so much. Appreciate the opportunity. I'm a board certified urologist representing the Washington State Urology Society. I also currently government affairs chair and past president. We are opposed strongly to this expansion of scope practice as listed in Senate Bill 5411. Most of the testimony has been regarding the pharmaceutical aspect of this bill, but remember, there's this whole issue about minor surgery, which is quite vague. Previously, the Washington Association of Naturopathic Physicians went to the Board of Naturopathy to get a definition, including vasectomy and in-office abortion. After at least 3 meetings that I attended, the Board of Naturopathy came out against a vasectomy being part of their scope of practice for multiple reasons. Although this is a common procedure, it's not really simple. It involves deep anesthesia into the spermatic cord. One has to have a strong understanding of male external genitalia to separate the vas from vital structures such as the blood supply to the testicle. Deep anesthesia does not seem to be part of the scope of practice. This seems like an end around after the Board of Naturopathy said no to vasectomy, and there was a letter from the Board of Naturopathy supporting this expansion, ignoring the previous discussion regarding Midas offer procedures. The letter from the president of Bastyr talks about pharmaceutical issues, which I will not address, but makes no mention of their training regarding Midas office procedures, which is vaguely described within this bill. So in general, we do not feel that this scope expansion, which includes minor surgery, which is not fully described and has been vetted through the Board of Naturopathy, and opinions from the Attorney General, which included significant potential risks and liability to those providing these services. So thank you again for your time, and we're in opposition. Thank you.
Thank you. Next up, Nancy Connolly, if you can raise your hand, we will unmute you. Nancy Connolly, are you here? How about Jean Hung? If you're here, would you please raise your hand so we can unmute you? Jean Hung, are you here? Justin Stamshore, are you here? If so, please raise your hand and we'll unmute you. There's Justin.
So thank you. My name is Justin Stamshire, and I'm honored to represent the Washington State Psychiatric Association as its current president. In my professional capacity, I serve as the medical director of an opioid treatment program, and also am a faculty member of the University of Washington Addiction Psychiatry Fellowship Program. Through my extensive experience, I've gained a deep understanding of the complexities and risks associated with controlled substances. These medications carry significant risks of abuse, addiction, and adverse effects, necessitating a cautious and expert approach to their prescription. It is because of this expertise and significant concern for patient safety that I, along with the Washington State Psychiatric Association, strongly oppose the current Sunrise proposal. The Washington Association of Naturopathic Physicians has proposed expanding their scope of practice to include prescribing controlled substances such as benzodiazepine stimulants and opioids, citing a perceived lack of access to care. However, in an era where we currently have an epidemic of addiction, I would argue that the issue lies not in access to these medications, but rather in the lack of access to knowledgeable care regarding their safe use. Decreasing this standard will just worsen this issue. I've witnessed firsthand the devastating consequences of inappropriate prescribing, even by well-meaning providers. One patient in particular stands out, a gentleman in his mid-60s with multiple comorbidities, including heart failure, COPD, panic disorder, and opioid use disorder. Despite the benefits he experienced from methadone treatment for his opioid use disorder, he tragically succumbed to an accidental overdose on legally prescribed Xanax, which had been started by a new primary care nurse practitioner who thought that he, quote, wasn't getting treatment for his panic disorder, end quote. His death serves as a stark reminder of the dangers inherent in prescribing controlled substances without proper consideration of individual patient factors, comorbidities, and proper education. Naturopathic physicians, while undoubtedly are committed to their patients' well-being, lack the comprehensive training and expertise necessary to identify these concerns. Unlike medical doctors who undergo rigorous education and training in pharmacology, physiology, and clinical practice, naturopathic physicians focus on alternative therapies and natural remedies, which are frequently unsupported by rigorous scientific validation or evidence-based physiology. This does not adequately prepare them for the complexities of prescribing controlled substances safely. Comparing the educational requirements between naturopathic physicians and medical doctors is like comparing apples to oranges. The educational contexts are vastly different. The training received by naturopathic physicians does not provide the necessary foundation for safe prescribing of controlled substances. In conclusion, I urge you to reject this Sunrise proposal and instead prioritize patient safety by limiting the prescription of controlled substances to qualified medical professionals. Thank you.
Thank you. And just a couple of reminders, if folks joined us late there, you can turn on your captioning if you need it at the bottom of the screen. There's you can hover over and they'll give you a little menu. And if you click that button, it will turn the captioning on for you. And we also keep putting reminders in our Q&A here, but please, if you are having any kind of technical issues, put that in the Q&A for us, but we're mostly using the Q&A just for that. And we are on number 32 right now. So I'm calling up groups of 3 to get folks prepared.
Barry,
And
you're on 31.
31's not here. So I'm
Oh,
skipping
31's
them.
not here. Thank you.
Yeah, good catch though. Yeah, so just a reminder, I'm calling 3 at a time, and then when your time's up, and when it's your turn, I'm asking folks to raise your hand so we can unmute you. And 2.5 minutes per comment. And just a reminder to please watch the timer on the screen. Folks are doing a great job of keeping it within the time, which is really helpful today. So the next 3 I'll call up are Timothy Clement, Teresa Richter, and Thomas Majeski. Timothy Clement, if you're here, would you raise your hand, please, so we can unmute you? Thank you.
Good morning. I'm Tim Clement. I'm a physician anesthesiologist in Wenatchee and speaking as president of the Washington State Society of Anesthesiologists in opposition to the scope expansion. First, several people have already said comments regarding the lack of education, the examples of scope overreach in the past, and the risks of this proposal. So I'll try and cover some other things. Anesthesiologists are at the forefront of patient safety. We advocate that no patient should be placed in harm's way due to lack of training or education, inadequate facilities, poor patient selection, or lack of safety or resuscitative or related emergency protocols. The proposal doesn't meet those standards. For example, the naturopathic community has interpreted the current minor office procedure provisions to allow naturopaths to administer nitrous oxide, but the appropriate regulatory guardrails to do this safely are not in place. We're concerned that further expansion of the minor office procedure provision would open the door to additional inappropriate interpretations, leading regulators to permit naturopaths to practice outside of their scope. As naturopaths do not receive adequate education and training to allow them to safely expand their prescriptive authority and perform the procedures outlined in the application, it follows that they are unable to determine the appropriate education and training required to necessarily safely prescribe or perform these additional services. This proposal defers to the Board of Naturopathy, which is made up of naturopaths and members of the public, to potentially put additional training and education requirements in place. But those individuals don't have a history of prescribing these drugs or performing these procedures. And so without extensive training in pharmacology, diagnosis, other elements of medical evaluation and treatment, that's inadequate to design the program to come up with this education and perform these procedures. Thank you for your time.
Thank you. Next up, Teresa Richter. Would you please raise your hand if you're here so we can unmute you? Teresa, oh, there you are. Hello.
Hello, can you hear me okay?
We can.
All right. Hi, I'm Dr. Teresa Richter, a licensed naturopathic physician, and I am the president of the Washington Association of Naturopathic Physicians. I am commenting in support of our proposal, and I want to thank the Department of Health for all of their hard work on this issue. This proposal is incredibly important as it increases access to care for patients, saves money for the state and insurance companies, and is demonstrably safe. The shortage of primary care providers has grown to an astronomical level, with some patients waiting over 6 months to be seen by a provider. This is the reality in the metropolitan area where I practice, and it's much worse in rural areas. Access to comprehensive care, including certain controlled medications, can mean the difference between life and death, between recovery and suicide, and between healing and worsening disease. When a patient needs a medication for their mental health that I can't prescribe, I have to find another doctor to provide the prescription. This takes extra time and effort for everyone involved. Mental health providers are in short supply, and many have closed their practices to new patients. I have patients on a daily basis who need mental health support, including management of medications for anxiety, panic attacks, and ADHD. When I can't prescribe a necessary medication for my patient, they may end up in an emergency department that is already overburdened, adding strain on hospital staff, providers, and resources. This is completely unnecessary when I could have prescribed the medication in a safe and thoughtful way with proper monitoring. Washington State defines naturopathic physicians as primary care providers, yet naturopathic physicians are the only primary provider types who cannot provide the full extent of primary care services to their patients. We are properly trained in advanced prescribing, and our philosophy and practice of naturopathic medicine often has us spending more time with patients than other provider types, allowing us to really know their issues and lifestyle. This puts us in a strong position to thoughtfully and carefully prescribe these medications when a more natural alternative isn't available, or when patients come to us already on these medications. Our profession is bound by the Uniform Disciplinary Act, and we defer to our regulatory board on rules regarding prescribing. Support for this proposal would improve access to care for patients, save the state money, and is safe. Thank you for your time.
Thank you. Next up is Thomas Majeski. If you could raise your hand so we can unmute you. Thomas Majeski. It's Madejski, in case I'm pronouncing it wrong. Are you here? Okay, I'm going to call the next three then. We have Vasish Srinivasan, hopefully close, Kevin Hodges, and Katina Rue. Vasish, if you're here, would you please raise your hand so we can unmute you? Last name is Srinivasan, in case I'm completely mispronouncing it. Hello, there you are.
Okay, can you hear me?
Uh-huh.
Okay, perfect. So good morning. My name is Vashi Srinivasan. I'm an assistant professor of emergency medicine, neurology, and neurosurgery at the University of Washington. I'm speaking on behalf of myself and as a board member of the Washington chapter of the American College of Emergency Physicians in strong opposition to this proposal. As an EM physician, neurointensivist, and stroke physician, I have seen the unmitigated harm that naturopaths can inflict on patients. I have personally treated multiple patients with severe life-ending strokes that could have been prevented with fundamental and basic primary care. I have colleagues with patients who became blind due to ozone injections. I have a 22-year-old who ended up on dialysis due to unnecessary and inappropriate antibiotic prescriptions. I have patients who died of end-stage cancer who could have survived if they were treated appropriately with radiation and chemotherapy instead of herbs and vitamins. When naturopaths are already failing to appropriately care for patients, expanding their scope seems at best ill-advised and at worst dangerous. Additionally, Washington State is in the middle of an opiate crisis. What we absolutely do not need are more individuals prescribing opiates. There have been comments here today about other professions prescribing opiates, but the data tell us that non-physicians prescribe significantly more opiates than physicians do. We do not need more opiates in Washington State. What we need are more responsible clinicians who practice evidence-based and scientific-based medicine. Under the statute that governs the Sunrise Reviews process, the bar for the department supporting a scope of practice expansion is appropriately high, with key considerations including a profession providing assurance of their ability to protect the public from harm through the scope increase, typically with increased education and training. This proposal jeopardizes public safety, especially given that the applicant repeatedly asserts that no additional education and training would be necessary for naturopath scope to be dramatically expanded. Thank you very much for this opportunity to speak today. And again, I and myself and behalf of Washington ACEP, I'm vehemently opposed to this proposal. Thank you.
Thank you. Next up, Kevin Hodges. You're here. Would you raise your hand so we can unmute you? Kevin Hodges, are you here?
Sherry, we had Dr. Majeski.
I
think
saw that,
it's-
yeah.
Yeah, okay, you saw that. Okay, thanks.
Yeah, I think, yeah, the names are not showing up. So for Thomas, I think it was under Billy Dickinson. So if you can raise your hand again, Thomas, then we can unmute you.
Okay, very good. Hi.
Hi.
I'm Dr. Tom Madejski. I'm a member of the American Medical Association Board of Trustees and a practicing internist, and I specialize in geriatric medicine and pain and palliative care. Thank you for holding this hearing today. In the interest of patients, I urge you to reject the proposal put forth by the Washington Association of Naturopathic Physicians. The truth is, if this proposal were adopted, it would be the broadest expansion of naturopath scope of practice in the country. The AMA knows of no state that allows naturopaths to prescribe Schedule II controlled substances without limitation. In fact, many states that grant naturopaths prescriptive authority prohibit them from prescribing any controlled substances at all. And defining surgery broadly to include primary care services is unheard of. If adopted, the proposal you are considering today would make Washington an outlier and put patients at risk. The broad scope expansions sought in this proposal are concerning given gaps in the naturopath's clinical training. Naturopaths are only required to complete 850 patient care hours. Physicians, by contrast, get at least 12,000 hours. The accreditation standards for naturopathic programs include no requirements that students see patients of any particular age or with any particular condition as part of this clinical training. What this means is there's no guarantee that a naturopathy student will treat patients who are sick or hospitalized during their training. They may also never take care of vulnerable patients like children or the elderly. This proposal would allow naturopaths to prescribe powerful medications to any patient for a broad range of illness. This would include psychotropic medications to treat mental illness. These drugs are serious. Many commonly prescribed psychotropics carry black box warnings. The risk of complications is high when these drugs are used in combination with other medications or in the presence of comorbidities, particularly cardiovascular disease. Only professionals with significant training and a comprehensive medical understanding of all body systems should be permitted to prescribe these drugs. We believe that allowing otherwise poses a danger to patients. We are also concerned about including primary care services and procedures incident thereto of minor injuries in the definition of minor office procedure. The proposed language provides no guardrails to ensure procedures performed by naturopaths are safe and within the limits of their training. Finally, this proposal will not improve access to care in Washington. Naturopaths and primary care physicians practice in the same area.
We're going to ask you to wrap up, please. Your time is up.
Thank you for the opportunity to testify.
Thank you. And I'm going to go back to Kevin Hodges. I believe that Sean, it's under Sean Graham's name. Maybe if you can raise your hand so we can mute the right person or unmute the right person. There you are.
Thank you very much. Hi, my name is Kevin Hodges, and good morning and thank you. I'm a practicing emergency physician in Richland, Washington. I'm also the vice chair for emergency medicine at the Washington State University College of Medicine, also the EMS medical program director for Adams, Benton, Franklin, and Yakima counties here in Washington. Today, I'm testifying in my capacity as an emergency physician and as a board member of the Washington American College of Emergency Physicians, and I am strongly opposed to this proposal. I'd like to focus primarily, if I could, on education and training. The applicant report repeatedly asserts that the education an naturopath receives is, quote, in line with or superior to that of physicians and other practitioners with expanded scope, end quote. To be clear, the education an allopathic or osteopathic physician receives is more standardized, more extensive, and more comprehensive than naturopaths, with prime focus on evidence-based treatment. For example, emergency medicine physicians, in addition to a 4-year undergraduate degree, and 4 years of medical school, also undergo 3 to 4 years of rigorous postgraduate residency training, not including any elective fellowship training. Naturopaths, in contrast, are not required to undergo residency at all. A physician's residency training is key to providing hands-on specialty-based training where physicians are mentored and guided over several years in how to assess and manage complex medical conditions, including pain, and how patient conditions and medications they may be receiving can interact with each other. Appropriately prescribing potentially dangerous medications requires a comprehensive medical education. You need to know not only pharmacology, but also those interactions between drugs, concurrent medical conditions, non-pharmacological interventions, and a myriad of other factors. A new pathway for prescribing, in this case for naturopaths, is not needed. There are already multiple educational pathways available to individuals of our state to enable them to have expanded prescriptive authority, including excellent allopathic and osteopathic medical schools, as well as programs for ARNPs and physician assistants, but there are no shortcuts to safe prescribing. As an emergency physician and the EMS medical director for 4 Washington counties, I'm at the front line of our massive opioid epidemic. I propose that increasing the number of opioid prescribers, as this proposal requests, is not the answer. The harm that could come from further proliferation of opioids and other drugs that have potential for addiction and other harm far outweighs any benefit we could see from this proposal. Thank you sincerely for the opportunity to testify against this proposal.
Thank you. Next up, Katina Rue, if you're here, would you please raise your hand so we can unmute you?
Good morning.
Good morning.
Good morning. My name is Dr. Katina Rue. I'm here on behalf of the Washington State Medical Association as the immediate past president. I represent over 13,000 physicians and PAs, and I'm testifying in opposition. The WSMA is committed to ensuring access to high quality care for all Washingtonians. However, the proposal under review is not an appropriate means to achieving this goal. I'm an osteopathic family physician and a family medicine residency program director at Trios Health in Kennewick. As a residency program director, I oversee the robust 3-year ACGME accredited training program for family medicine physicians. Family medicine residency curriculum includes inpatient and outpatient direct patient care training in pediatrics, obstetrics and gynecology, the medical specialties, psychiatry and behavioral health, general and orthopedic surgery, and dermatology, amongst others. The comprehensive nature of family medicine training ensures that family medicine physicians are prepared to provide the safest, evidence-based, and culturally appropriate care to patients of all ages. At the end of their residency, a family medicine physician will have completed between 12 and 16,000 hours of patient care. The concept of graded and progressive responsibility is one of the core tenets of graduate medical education. Many physicians report that the residency training period is what best equips them with the training and expertise required to practice safely and effectively. Naturopaths, by sharp contrast, are not required to complete residency. Unlike allopathic and osteopathic physician training, there is no requirement for naturopaths to treat patients across the lifespan, patients who are sick, hospitalized, or patients with any particular medical conditions. Naturopathic education does not compare to that of an allopathic or osteopathic physician, and as such, does not prepare the naturopathic profession to accurately diagnose, safely prescribe, sign patient documents, and perform procedures considered in the proposal. This is a matter of patient safety. As a crucial underpinning of their proposal, we are concerned that the applicant has mischaracterized naturopathic education and training to be on par with that of MDOs. It's not comparable or equivalent. Thank you for the opportunity to provide this comment.
Thank you. And just reminding again, in case we've got folks that have joined later, I think we're on number 36 right now. Out of 56, we are on 38 of 56 folks. And just really quickly, I'm calling 3 at a time. And then when it's your turn, I'm calling the name and asking folks to raise your hand so we can unmute you to comment. We're providing 2.5 minutes for your comments. Make sure you watch the clock on the screen so that we can keep on time. And thank you to everyone who has done a great job of keeping within the time limit. So next up will be John Bramhall, Matthew Holland, and Melody White. John Bramhall, if you're here, can you raise your hand, please? There you are.
Yes, good morning. I'm Dr. John Bramhall. I'm speaking on behalf of the WSMA and obviously in opposition to the Sunrise proposal before you today. The WSMA has grave concerns with the assertion that naturopathic education and training adequately prepares the profession to describe controlled substances and perform the procedures outlined in the application. Look, controlled medications are controlled for a reason. Safe and appropriate administration requires a great deal of education, training, and experience, particularly when multiple medications are prescribed for multiple diagnoses in a single patient. While I respect the care that naturopaths offer to their patients. Their naturopathic education focuses on philosophical principles rather than evidence-based practices and methods. The emphasis on natural healing does not really prepare for the appropriate use of powerful and effective pharmacotherapies taught during standard medical education. As you know, physicians have already undertaken a rigorous basic science education before they're even eligible to be admitted to medical school. Then the 4 years of medical school education itself is rigorous, closely overseen, regulated by national liaison committees. It's followed by a residency, 3 to 5 years of duration, overseen again by national accreditation committees that require very strict adherence to syllabus and standards. I'm a professor here at the University of Washington. I've been involved in this type of resident education for over 30 years, and I can attest to you that the training is hard, it's complex, it's rigorous, and it leads to the production of seasoned clinicians who are only then competent to diagnose and treat a wide range of illness and disease. As noted just now by my colleague, Dr. Wu, naturopaths are not required to complete any residency. The very training and experience that best equips a physician to perform their duties safely and effectively. Concretely, DEA Schedule II drugs are defined as drugs with high potential for abuse, with potentially dangerous side effects, with some leading to severe psychological or physical dependence. Now, more than ever, their availability needs to be strictly regulated and controlled. This is no time for loosening sensible restrictions on their description and availability. Thank you for the opportunity to testify against this Sunrise Review. Thank you.
Thank you. Next up, Matthew Holland, if you're here, it's Hollon. If you're here, can you raise your hand so we can unmute you? Thank you.
Good morning, and thank you for the opportunity to provide comment. My name is Dr. Matthew Holland. I'm a medical educator and primary care internal medicine physician in Spokane and Secretary Treasurer of the Washington State Medical Association, speaking on their behalf today. My perspective is also informed by the privilege of having worked with and trained a physician rheumatologist who left her career in naturopathy because she did not feel it adequately trained her in the science of medicine and provide her the ability to provide full scope of care for patients. As noted previously, the WSMA is committed to ensuring access to high quality care for all. However, the proposal under review is not an appropriate means to achieving this goal, and I oppose this proposal. As a primary care physician, I find the proposal's modification of the minor office procedure term within the current scope of practice particularly concerning, specifically the inclusion of primary care services and procedures incident thereto of minor injuries. These terms are vague, which is a concern given the current narrower minor office procedure provision has proven open to misinterpretation. The proposed updates to the naturopathic minor office procedure provision would open the door to any number of services without ensuring requisite education and training has been attained, which ultimately puts patient safety at risk. We're also deeply concerned about the expansion of naturopathic prescriptive authority to include Schedule 2 through 5 drugs. This is a significant increase in authority without stipulating any additional education and training requirements. In addition to opiates and psychotropic drugs, naturopaths would be allowed to prescribe other narcotics, tranquilizers, sedatives, stimulants, and non-narcotic analgesics. The fact is that all scheduled drugs can be dangerous, which is why they are scheduled in the first place. Prescribing these drugs safely requires the highest level of training and expertise, and this is especially true when co-prescribing with other drugs and managing multiple health conditions as we do in internal medicine. Understanding the interaction of medications requires a physician to utilize their medical education and clinical experience to the fullest extent. In the application and the language drafted in SB 5411, the applicant did not demonstrate an understanding of the increased responsibility that comes with expanded prescriptive authority and the performance of advanced procedures. In any scope of practice proposal, the consideration of patient safety and ensuring quality care is paramount, and this proposal fails to meet those standards. Thank you for your time and consideration.
Thank you. Melody White, if you're here, would you please raise your hand and we'll unmute you? There you are. Go ahead.
Thank you. My name is Melody White. I'm the Chief Operations Officer for Family Health Centers and FQHC in Okanagan and Douglas counties. I am in support of the additional scope for our naturopaths. I obtained my degree from Loma Linda University and have 42 years experience in healthcare administration. I've had the pleasure of working with naturopathic physicians at Family Health Centers for 7 years. We also have a residency program for NDs in conjunction with Bastyr University. Prior to working directly with naturopathic physicians, I was also misinformed as to the value, training, and experience of NDs. I quickly learned that they were supportive of vaccines and science-based decision-making and watched many traditionally biased MDs begin referring their patients to the NDs and speak highly of the high quality and appropriate primary care services that aligned with their training. The patients of our NDs have high clinical quality scores, high patient satisfaction, high positive outcome statistics, and very low incident reports. Our NDs work well and have the respect of their peers who are MDs, DOs, advanced practice providers, and pharmacists. They hold some of our highest patient panels in Brewster, Bridgeport, and Tonasket. The prescriptive restrictions currently are a barrier to care for the patients who have chosen an ND as their PCP. In my own personal experience, I have family members who are required to schedule duplicative visits with APPs who have actually less training and less experience in order to receive the needed medications. This has often resulted in high wait times, weeks without the necessary medications, and unnecessary additional expenses for themselves and insurance claims. In our organization, our NDs hold well-respected leadership positions as Chief Quality and Compliance Officer and Clinical Director. The current regulations are restricting them from caring for their patients to their full capacity. Thank you.
Thank you. So the next three up are Navid Malakouti, Jennifer Alexander, and Shannon Hurst. Navid Malakouti, if you're here, can you raise your hand, please, so we can unmute you? There you are.
Hi, good morning. Thank you. My name is Dr. Navid Malakouti. I oppose the bill. I am a practicing medical doctor with board certification in dermatology. I am also a medical director for the largest dermatology group in the Pacific Northwest. I serve on the company's medical advisory board, quality improvement committee, and I chair the cosmetics committee. The many hats I wear collectively require me to oversee all issues pertaining to the practice of medicine and cosmetics for about 100 physicians, physician assistants, nurse practitioners, and licensed estheticians. Issues regarding the delivery of care are particularly important to me. I was alarmed to discover that the naturopathic community feels it is prepared to begin performing minor in-office procedures, arguing that their training meets the prerequisites to safely and accurately perform such procedure. This idea that naturopaths have any level of similar training to that of a medical doctor, let alone one who has additional residency training, is patently false. The thousands of hours each primary care medical doctor or specialist receives to accurately and safely perform their skill set is being undermined by this notion that safety is not as important as access. I fear this increased access will proportionally lead to harm. The definition of a minor office procedure is a misnomer. The definition was created by Medicare to define the covered period following the procedure being performed, 10 days for a minor and 90 days for major. These procedures can be anything but minor and include technically challenging procedures where errors can result in morbidity and mortality. They require nuanced knowledge of tumor subtypes, abnormal anatomy, and complex follow-up knowledge and skills that naturopaths do not have. In my 5 years of working in Washington after completing residency, I have seen naturopaths attempt to treat biopsy-proven skin cancer with topical vitamin C. When I spoke with this provider, they defensively shared an article about vitamin C killing cancerous cells in vitro, which shows a lack of understanding of the scientific literature and its translation to patient care. I have seen overuse of potent topical steroids on the genitals of an elderly male, resulting in severe atrophy and loss of functional use, and thousands of dollars worth of unnecessary tests without any sound reason for ordering them. I am concerned that by granting naturopaths these privileges, Washingtonians will be harmed. I worry Washingtonians will become addicted to narcotics. Washingtonians will be misdiagnosed and treated below the standard of care. I feel Washingtonians will suffer if this bill moves forward. So please ask yourselves, if Washingtonians will not benefit, who does?
Thank you. Up next, Jennifer Alexander, would you please raise your hand so we can unmute you? There you are.
Good morning. I'm Dr. Jennifer Alexander, Senior Director of Clinical Care at HealthPoint Community Health Clinics in King County. We support the Sunrise Review. HealthPoint was one of the first federally funded organizations in the country to employ naturopathic physicians as part of our multidisciplinary care teams. We're also an important provider of primary care for many patients receiving Medicaid coverage in the state of Washington, as well as refugees, asylee seekers, and many of the uninsured residents of our state. Over the years, we've found that our patients greatly benefit from having access to naturopathic services. Our naturopathic physicians serve as primary care providers and consultants for many of our patients. Since being included in the Washington State Medicaid programs, more patients than ever seek NDs as their PCP in our clinics. The number of NDs participating in Washington State Medicaid plans grows every year, and now it numbers over 450, representing over 30% of NDs licensed in Washington. With the well-known primary care provider shortage, NDs are stepping up to fill that need. We've been impressed with their competence and compassion and how they interact with and serve our patients at HealthPoint. The proposed prescriptive scope expansion and clarification of minor office procedure language, along with the ability to sign common public health forms, will help improve the service they offer our patients. We agree that the current limitations on their prescriptive authority risk duplications of services between our NDs, MDs, and DOs, and other advanced practice clinicians. Unnecessary visits or time spent consulting unnecessarily within busy primary care settings drains our resources and costs patients, insurers, and the state valuable time and money, and can result in suboptimal care for our patients. In addition, the scope expansion would help to fill critical need for more providers equipped to treat patients struggling with opioid use disorder by allowing NDs to prescribe the life-changing medication buprenorphine. Expanding naturopathic prescriptive authority along with other changes proposed makes sense. NDs have been safely managing the full prescriptive authority with all legend drugs and the controlled substances testosterone and codeine preps since 2007. Our NDs are well trained and have been valuable members of our care teams for over 20 years. We recommend you support the Sunrise Review.
Thank you. Shannon Hurst, if you're here, would you please raise your hand so we can unmute you?
Okay, okay,
you're good to go.
Okay, my name is Shannon Hurst. I'm a 2007 naturopathic medicine graduate and former Bastyr University resident. I oppose this scope increase for NDs. While I understand the goal of lawmakers is to expand healthcare workforce and close healthcare access gaps, there are important public safety issues to consider when voting for this. This profession has little to no conflict of interest literature, curriculum, or literacy, despite the public example that has been set in conventional medicine over the last 40 years. It has also resisted setting standards of care. NDs have some of the highest debt-to-income ratios for graduate students in the nation. Logical questions to arise from this might be, what is naturopathy's North Star at this time? Is it patients? Is it its own ideology? Is there a risk of decisions being driven by debt? How might the field react when tested, and how would it navigate financial distress with increased privileges? In terms of leadership, the Washington State Medical Association referred to the Board of Naturopathy as failing to both evolve and consider patient safety as its primary duty. The BON has continued to rely on ideological arguments when drafting continuing education requirements. This is despite licensee outcry and pointed concerns about public safety. The board is struggling to regulate the scope we already have. This is being done with the support of naturopathic organizations and schools. In this process, the board has elevated arbitrary CE sources. You can view a critique of official industry materials provided to you in your packets. Finally, in 2025, as part of Title IV money reform, the Department of Education's financial value transparency is set to begin. As one of the highest graduate degree debt to earnings ratios, this rule could have impacts for naturopathic academic institutions. I believe this scope increase is not the answer to Washington State's healthcare gaps. Thank you. I yield the rest of my time.
Thank you. So we're coming up on 11 o'clock. So let's go ahead and take our second break, our last break. So please come back by 11 o'clock when we'll hear from Paul Surratt, Kelly Wright, and Andrew Simon will be up after the break. Okay, it's 11 o'clock, so let's get started again. Welcome back. The next three I called were Paul Surratt, Kelly Wright, and Andrew Simon. So if Paul Surratt is here, would you please raise your hand so we can unmute you? Thank you.
Morning. My name is Paul Surratt, and I'm speaking today on behalf of the Washington Academy of Physicians Assistants, or Physician Assistants, or WAPA. There are approximately 5,000 PAs across Washington State. Thank you for the opportunity to provide comments on the Department of Health Sunrise review of the naturopath scope of practice. While WAPA supports improving access to high-quality healthcare, we have concerns that the application submitted by the Washington Association of Naturopathic Physicians, or WANP, inaccurately describes PA education and training in pharmacology to bolster WANP's case for significantly expanded prescriptive authority. We disagree with WANP's argument that naturopaths satisfy the same pharmacological education requirements as PAs. WANP cited the UW MEDEX's program as an example of PA pharmacology education and asserted that PAs only receive 6 credit hours. This is a gross oversimplification of PAs training. PAs are educated in the medical model, most often at the master's level, and the PA model is intended as an accelerated program that recognizes and builds upon the clinical experience of incoming PA students. A recent UW MEDEX class had on average over 8,000 clinical hours upon matriculation. While there may be a limited number of credit hours in didactic training that is specific to pharmacology, each subject covered during PA education generally includes pharmacology, including medical management with risks and potential interactions, etc. WANP's application also didn't account for pharmacology learned during a PA's 2,000 hours of clinical training. WAPA estimated that with 80 to 90% of patients that PA students see, there is a discussion about what medication the patient is taking, as well as what medication should be ordered, changed, or stopped. During a PA's clinical training, if a PA student saw 6 patients a day, spent 5 minutes on medication review per patient, 5 days a week, with 50 weeks of clinical rotations, a PA student would, on average, earn 75 hours of pharmacology training in a clinical setting. This is a conservative estimate, as many PA students see twice as many during their clinical rotations. We urge the Department of Health to consider WAPA's representation of its professions, clinical and didactic pharmacology education of PAs while reviewing the naturopathic scope of practice, and I appreciate the time. Sorry for going over time.
Thank you. And next up, Kelly Wright. Can you raise your hand if you're here so we can unmute you? Kelly Wright, are you here? Don't see a hand, so let's move on to Andrew Simon. If you're here, would you please raise your hand so we can unmute you? Hello.
Hello, my name is Dr. Andrew Simon. I'm a practicing naturopathic physician licensed in the state of Washington for the last 10 years. I completed my residency at Bastyr Center for Natural Health here in Seattle. I'm currently the Power of Providers Naturopathic Representative, which is an advisory committee to the Department of Health. On the Power of Providers, we regularly meet once a month with multiple other inter-allied professions, including pediatricians, infectious disease, family practice physicians. In this group, I am a regular advisory member for the COVID pandemic regarding things such as COVID vaccine access to underserved populations, reaching conversations around the consequences of the COVID pandemic, now including long COVID, mental health crises that are facing the state, as well as the opioid issues at hand. And so I'm in full public support of and clinical support as a practitioner of this medicine. I'm also an adjunct faculty member at Bastyr Center for Natural Health, where we are regularly training our student clinicians on the diversity of our full scope and practice and skills, including primary care medicines, including pharmaceutical medications. I speak to this specifically because in 2014, when I was beginning my profession as a resident, we advocated for the Medicaid scope expansion that took place 10 years ago. And in that time, our expertise and education working within the primary care medical system has, as you've seen by many other callers on this call, advanced our profession in terms of the ability to work in primary care settings in the allied health profession. As a Power of Providers member, I have seen the inclusion of our profession in the conversations that are directly impacting public health advocacy policy about how naturopathic physicians can currently fit into the current issues at hand. The long COVID pandemic, for example, many of the medical providers working at long COVID clinics, including Harborview and the greater area, including the infectious disease physician that diagnosed the first case of COVID, have said directly in our committees that the naturopathic physician is absolutely pivotal to the role of addressing the public health concerns facing our state at this time, including the use of our therapies and modalities and our holistic viewpoint, which can include, in a safe and practiced way, the use of these pharmaceutical medications. I practice mental health, and I need to be able to also de-prescribe these medicines when safe and appropriate, working with other allied health professionals. Thank you very much.
Thank you. Next up, we'll have Laura Wagner, Paul Anderson, and Leanna Standish. Laura Wagner, if you're here, would you raise your hand so we can unmute you? Thank you.
Do you hear me?
Yes, we can.
Hi, my name is Dr. Laura Wagner. I'm a naturopathic physician in the state of Washington, and I practice primary care. Today I want to talk about how this would help my practice, because I would be able to provide better care for my patients who are prescribed psychiatric medications from their psychiatrists. Frequently, these psychiatrists leave the state, they have an issue with their family, they take time off, and my patients come to me and say, well, you've been my doctor for 10 years. Can't you prescribe this for a month, for 2 months? And I can't. So I have to send them basically to urgent care to beg for their medications. And as we've already heard today, this puts their life at risk sometimes. I've had patients say, I don't want to be stigmatized to go ask for my ADHD medicine at the urgent care. Maybe I can just wait. Maybe I'll just take a month off and wait until my next appointment with a new provider. And that is so dangerous. So I would love to have this bill passed, because I think it would help primary care providers like me provide total primary care for patients who we have created these relationships with over the years, and we know their medications and what they take. It's so simple to help this problem here. And what it does right now, we create this extra redundancy, multiple providers, multiple visits, and patients get exhausted with that. Okay, and then I want to go on to prescribing Suboxone would actually allow naturopathic physicians to work more with the tribes in Washington state, because we could supervise nurse dispensers. Also, a lot of naturopathic physicians like myself, I have a master's degree in acupuncture, a certificate in Chinese herbs. I did some of my training in Shanghai, People's Republic of China. We have transcripts that read like ChatGPT's Amazon wish list. So when we're able to come to a community or a tribe, we bring with us a plethora of information, our background and experience. So being able to provide that kind of care to tribes would be just amazing in Washington state. And I also want to thank the Senate and the Department of Health and remind everyone, we're not here to discuss any information deficits on behalf of any individuals, organizations, or associations who don't know the facts about our training and education. Thank you very much.
Thank you. And Paul Anderson, if you're here, would you please raise your hand? There you are.
Okay, you can hear me?
Yes, we can.
Thank you. My name is Dr. Paul Anderson. I'm a naturopathic physician practicing in the state of Washington currently. Additionally, I've practiced and held licenses in the states of Oregon and Arizona as a naturopathic physician. I have taught naturopathic physicians as well as other allopathic professionals for 30 years at this point in both didactic settings and CME settings. As for the management of prescriptions of controlled substances, I have managed class 2 through 5 safely under my licensure in Oregon and Washington, and also practiced safe minor surgery procedures, which are common to general primary care practice in those jurisdictions as well. As for training, specifically in the state of Washington, but also in those other states, as a professor of pharmacology and clinical medicine, I've taught physician CME as well as naturopathic medical students, specifically in the pharmacology and management and safe prescribing and deprescribing of controlled substances at Bastyr University and at other universities. I am strongly in support of this Sunrise Scope review, and I thank you for your time.
Thank you. And Leanna Standish, if you're here, would you please raise your hand so we can unmute you? Thank you.
Good morning, and thank you for this opportunity to speak. My name is Leanna Standish. I'm a physician and a clinical scientist living and working in Seattle. I have been on the faculty of the University of Washington as well as Bastyr University. I specialize in integrative oncology, and I've treated thousands of cancer patients. I am board certified as a fellow of the American Board of Naturopathic Oncology, and most of my patients are referred to me by medical oncologists. I have trained dozens of residents over the last 30 years. I have published research papers showing the safety and efficacy of natural medicines, including intravenous administration of plant polyphenols in cancer patients. My medical training at Bastyr University included pharmacology and safe prescribing of all scheduled drugs. As an MD, I am required to maintain continuing pharmacology training on a yearly basis. Naturopathic physicians are trained to be primary care physicians. I often serve as my cancer patients' primary care physician after they have completed their primary cancer treatment. And very occasionally, my patients need strong medications for pain, sleep, nausea, such as opiate agonists and benzodiazepines. Without the legal ability to prescribe scheduled pain and sleep medications, I am hampered in my ability to care for my patients. Yes, it's true that MD, medical doctor education, is different from naturopathic doctor education, but that does not mean that it's inferior. Washington State has a shortage of primary care physicians. In Oregon, NDs have expanded scope of practice, and NDs are better suited to be effective primary care physicians in Oregon than they are in Washington State. Therefore, I support the expansion of the naturopathic physician scope of practice. Thank you very much.
Thank you. Next three I'll call are Stanley Fleming, January Austin, and Christopher Chambers. And Stanley Fleming, if you're here, would you please raise your hand and we can unmute you? Stanley Fleming, are you here? I'm not seeing a hand. So January Austin, if you're here, would you please raise your hand? Thank you. You're good to go.
Good morning.
Hold on.
Good morning. My name is Dr. January Austin, and I'm the medical director at the Lower Elwha Clallam Tribal Health Department. I am a doctor of naturopathic medicine, and I earned my degree from the National University of Natural Medicine in Oregon. Prior to attending naturopathic medical school, I was required to obtain an undergraduate degree as a prerequisite. I obtained a Bachelor of Science in Biology with a pre-med medicine option and minors in chemistry, ethnic studies, and mathematics. I am in support of increasing the scope of naturopathic physicians in Washington State to be more in line with our extensive training. As you can see by the documents others have submitted to this committee, my coursework was rigorous and training in pharmacology was extensive. My pharmacology professor had dual degrees, and he was an MD. In our first meeting of our pharmacology courses, he stated that he was going to ensure that our coursework would stand up to this kind of questioning on whether or not we received enough training. In order to obtain a license in Washington and in Oregon, we are required to pass pharmacology board testing to ensure we have a firm grasp on indications of medications, safety concerns, and standards of practice. As a tribal facility here in rural Washington, it is very important to us to have naturopathic physicians be able to work to the full scope of our training in Washington State as they are in Oregon. The current restrictions often delay care of our patients in an area where it can take up to 6 months to see an MD. I have seen this in patients that are trying to get off of opioid medications, and we are not able to create tapers for these medications safely. And by the time they get to another provider, that window of opportunity to decrease the opioid medication is missed. We also have extensive training in minor office procedures, and this can be seen in our coursework as well that I saw was submitted to the committee. So I urge you to review this coursework, and thank you for your time.
Thank you. Next up, Christopher Chambers, if you're here, would you please raise your hand? Christopher Chambers? Are you here? Don't see a hand, so I'm going to call, let's see, next three, Brendan Smith, Jeffrey McLaren, and Jeffrey Brousseau are next up. Brendan Smith, if you're here, would you please raise your hand? Thank you.
Hello. First, I'd like to thank our partners at the Department of Health for the opportunity to speak today. My name is Dr. Brendan Smith. I'm a naturopathic physician and the Chief Quality and Compliance Officer at Family Health Centers, a federally qualified health center serving the communities of Okanagan and Douglas County, Washington. I was the chief resident of Bastyr University in 2012, was a trainer with McMaster University Evidence-Based Clinical Practice Program, and served as a professor in evidence-based clinical practice at Bastyr University prior to my position at Family Health Centers. I'm here to support the Sunrise Review and expansion of scope of practice for naturopathic physicians in the state of Washington. I am uniquely positioned to speak to the role of naturopathic physicians and quality and compliance concerns related to safety and risk within primary care. First, states with expanded scope have naturopathic physicians working in federally qualified health centers, community clinics, rural clinics, and serving underserved communities. The emphasis I want to make is that the management and treatment of patients on controlled substances is often initiated outside of primary care and then passed to primary care to manage. This scope expansion supports the continuity of care within the primary care patient relationship for naturopathic physicians. Second, data supports the safety of naturopathic physicians, which is unique and separate to the use of complementary and alternative therapies, often self-prescribed by patients, per the sort of quotes earlier around the evidence against our profession. I request that objective data on naturopathic physician profession be evaluated as the driver of scope expansion. Third, naturopathic physicians are requesting both expansion of scope and all regulation, training requirements, and oversight included to preserve public trust and safety in care delivery. This proposal should be evaluated against precedents set by the scope and training of other health professionals in Washington state. Finally, harm is caused if we lose sight of what is patient-centered. Patients need greater primary care access. Patients need top-of-scope licensed providers to meet their needs, and patients want naturopathic physicians available to serve their whole spectrum of primary care needs in Washington state. Thank you again for your time.
Thank you. Jeffrey McLaren, if you're here, would you please raise your hand so we can unmute you? Thank you.
Can everyone hear me?
We can.
Wonderful. Hi, my name is Dr. Jeff McLaren. I'm here as a board member for the Washington State Society of Anesthesiologists, and I'm an interventional pain physician working currently for Kaiser Permanente in both King and Pierce County. I want to thank everyone for their comments today. I am here in strong opposition of this proposal. I agree with others that the vague language around minor office procedures is too broad and allows too much interpretation of what is an office-based procedure. I perform procedures daily where I access a patient's spinal cord deep within the body. To do this, I was required to do 4 years of undergraduate, 4 years of graduate medical education, 4 years of anesthesia residency, and a year in a subspecialty fellowship. Each step I took in the process to get to where I am today required thousands of hours, thousands of patients, and thousands of procedures to have enough knowledge to do these. The procedures I do are deemed an office procedure, yet my own specialty has considered these procedures dangerous enough that they do not support anesthesiologists doing this without training from an accredited program. The language around the procedures is too broad and would put patients at risk. From what I've heard today, there is support for naturopathic providers and their ability to help improve access to patients and provide great care to patients. However, this does not support expanding practice to that of allopathic and osteopathic physicians. The areas where I've heard success with naturopathic physicians have been in multidisciplinary practices where there's teamwork and cultural norms in practice to hold practitioners accountable for the care they provide. However, it is my guess that most naturopathic doctors are not practicing in multidisciplinary teams, but rather independently, without the proper oversight of their patient care, and where patients can be put in danger of someone doing a procedure they have probably done only a handful of times, and likely lack the fundamental anatomical and physiologic knowledge to perform this well. I think for Washingtonians' best safety, we need to review this and change some of the language to better fit what this is intending to do. Thank you for allowing me to speak today.
Thank you. And Jeffrey Brousseau, if you're here, would you please raise your hand? Okay, thank you.
How about that? Can you hear me now?
Yeah, we can hear you.
Thank you. Good morning. Thank you, Department of Health, for offering this to the public. I'm in full support of expanding this Sunrise proposal. I'm a layperson. I don't have initials after my name. I'm a caregiver of my wife of 35 years. She has chronic health conditions. She had a stem cell transplant at University of Washington. She's has a cardiologist at University of Washington. We're big fans of medical doctors. And we supplement that care with a naturopath who helps us to coordinate our communications and our testing and our treatment of my wife, who needs a lot of complicated care. And frequently, she will have an emergency, and sometimes medical doctors, MDs, are difficult to reach. Our particular naturopathic doctor is available for us on weekends and after hours. We've had a number of emergencies where a medication is needed, often in a life-saving measure. So from this one person and this one family in the state of Washington, we are very much supportive of expanding the scope of our naturopathic doctor and his ability to treat us with all the very complicated measures that my wife requires. She has congestive heart failure, and most every day is up and down. And to have another ally on our side who's just does such a great job consulting with the rest of our medical doctors, and he includes them and they dialogue together. It's just a fantastic team, and hopefully my wife's going to live a lot longer. So thank you for listening.
Thank you. I'm going to now start pulling other folks in that we've called on earlier. And I think
we're missing, sorry, we have Sungwon Kim still left.
Yeah, I was going to call her.
Sorry
and
about
then, yeah, no, that's okay. And I'm keep kicking on my toes. I want to still call 3 at a time. So starting with Sungwon Kim, who has not been called yet. And then up after that, Joy Nauman and Tanya Gren will call to you again to see if you're here this time. So Sungwon Kim, if you are here, would you please raise your hand? Sungwon Kim, are you here?
They may be appearing as Billy because every time you've called that name, a person under Billy has raised their hand.
Okay. All right, you should be good to go now. Thank you.
All right. I'm sorry. I don't know why it comes as Billy Dickinson up. Oh, I know why. Okay, never mind. Apologies. Hey, I'm Sungwon Kim. I am the practicing otolaryngologist here in Olympia, Washington, and currently serve as the president of the Northwest Academy of Otolaryngology, which represents the interests of ear, nose, and throat specialists here in Washington State. Sorry, we have very deep concerns about the naturopathic scope of practice presented by the applicant here. Specifically, we are concerned that there are elements of this proposal that would compromise the safety of our patients and negatively affect the quality of care in our state. Specifically, and we've just, and many of this has been brought up many times before, naturopath education is not equivalent to education received by physicians. I don't want to belabor this point, but I do want to say that the average physician does have over 16,000 hours of clinical training, whereas the average naturopath has 72 to 1,200 hours of training. Many naturopaths may even graduate with the program without even seeing a hospitalized patient. But I gotta be honest with you, that's not what bothers me the most. Inexperience aside, we're in the middle of an opioid crisis nationwide, Washington State not excluded. Hundreds of Washingtonians die every year from overdose. Chances are many of the constituents you represent have been personally touched by this crisis. And for me personally, I have a brother who's an opioid addict who struggles daily to get through his day. House Bill 1427 was passed in 2017 to reduce the impact of this specific epidemic. And I, like all other physicians in Washington State, have undergone an extra 8 hours of training on the opioid prescribing practices, as you probably well know, in the Department of Health. We are prescribing less narcotics, which is fantastic. It works great. I don't understand why we're walking back, or why we're considering even walking back on our commitment to Washingtonians to address this specific critical crisis issue. I don't understand why we're trying to put a finger in the dike and also poke another hole in the dike at the same time. Is it to improve access to healthcare? Access to healthcare is abundant. I believe this only improves access to opioids and unfortunately worsens healthcare outcomes for all Washingtonians without improving access to healthcare resources. In conclusion, we at the Northwest Academy of Otolaryngology strongly opposed this proposal. Thank you.
Appreciate it. Joy Nauman, if you're here, would you raise your hand so we can unmute you? Joy Nauman, are you here? I'm not seeing a hand, so let's call up Tanya Gren. Are you here? Tanya Gren? I don't see a hand for you either. So now I'm going to call 3 more up. Let's go with Lana Ferris, Jinda Chaginda, and Tressa Pinkleton, if you're here. Lana Ferris, would you please raise your hand so we can unmute you if you're here? Lana Ferris, last call. Jinda Chaginda, are you here? If so, raise your hand, please. And how about Tressa Pinkleton? If you're here, would you please raise your hand? All right, how about Nancy Connolly, Jean Hung, and Kelly Wright? Nancy Connolly, if you're here, would you please raise your hand? Thank you. And you're good to go.
Hi, can you hear me?
Yeah.
Yeah, so my name is Dr. Nancy Connolly. I am a primary care doctor who has practiced in the state of Washington for the last 15 years, roughly. I am strongly in support of allowing naturopaths increased scope of practice. I have been practicing primary care. I'm trained in addiction medicine, integrative medicine, as well as infectious disease. And in my experience working with my naturopath colleagues, they have exceptional training in holistic care and in nutrition, which is something that I think many MDs historically have not gotten as good training in. Talking about access to healthcare, I don't know how many of the members of the committee have tried to get a new primary care doctor lately, but even for myself and my family as a primary care doctor, knowing people in the community, it's not easy. And to increase access to primary care in our community at this time when there's addiction problems, when there's so much mental health problems, when nutrition is a huge problem, these are things that naturopaths are very well qualified to treat. We are fortunate to have Bastyr in our neighborhood, which does marvelous training. So once again, as a primary care MD physician practicing in the state of Washington for as long as I have, I'm strongly in support of increasing naturopath scope of care. And I'll see the rest of my time.
Thank you. Jean Hung, if you're here, would you please raise your hand? Jean Hung? Thank you.
Hi, can you hear me?
We can.
So I'm Dr. Jean Hung and I support this proposal. I am a pediatric naturopathic physician in Washington State. I work in a family medicine clinic with other NDs and we all focus on primary care. We are a VFC site. I completed a 2-year pediatric residency and I'm also board certified with the Pediatric Association of Naturopathic Physicians. One condition we see all the time in primary care medicine is ADHD. Every week, if not every day, I can confidently diagnose ADHD, discuss behavioral interventions for ADHD, help create 504 plans, talk about diet, nutrition, exercise, research behind supplements, talk about community resources with parents. I can manage the non-stimulant medications, like Strattera, clonidine, guanfacine, but I can't manage prescribed stimulants, which are the first-line pharmacological treatment and happen to be Schedule II drugs. These are things I learned how to do in residency. I was supervised by both an MD board-certified pediatrician and naturopathic physicians. But I'm not allowed to manage these for my patients because of scope. I have other pediatric ND colleagues in the same boat, and this bill would allow us to better manage our patients with ADHD. It can take weeks to months to see your primary care provider. I sometimes see patients who are not just struggling in school, but falling behind so much they're at the verge of being held back a grade. So for that medication management piece, I have to refer out often to my psychiatric nurse practitioner colleagues in the community, and that just delays care. These kids are waiting months to get treatment. And one of the biggest resources in our community for children, Seattle Children's Hospital, they don't even offer long-term medication management as a service. They refer out to the community. So the majority of NDs are primary care providers, and this bill is about letting us be able to be on more equal footing, not with our MDDO colleagues, but also with our other advanced practice providers like PAs and ARNPs, as others have mentioned. They do have more prescriptive authority than we do, and I'm not downplaying their training in any way. Expanding our prescriptive authority means comprehensive primary care, and that is crucial for our pediatric patients. Thank you.
Thank you. Kelly Wright, if you're here, would you please raise your hand so we can unmute you? Kelly Wright, are you here? Don't see a hand. So let's see, Stanley Fleming and Christopher Chambers. If you're here, we didn't catch you earlier. Stanley Fleming, if you're here, would you please raise your hand? Stanley Fleming? And how about Christopher Chambers? Would you please raise your hand if you're here? Thank you. You're good to go.
Hi, I'm Chris Chambers. I'm an oculoplastic surgeon and ophthalmologist at the University of Washington, but I will not be speaking on behalf of the University of Washington or the state of Washington. I'll be speaking on behalf of the Washington Academy of Eye Physicians and Surgeons, and I oppose this. I have in my 18 years of practicing medicine, I have the unique opportunity. I've always been in academic medicine. I've had the unique opportunity to participate in the training of multiple allied health professionals, including MDs, medical students, naturopaths, nurse practitioners, physical therapists, and I have a unique understanding of the difference in training these particular specialties have and these different training pathways have. And I don't believe there's appropriate training. Not to say I think there's an importance for all of these medical subspecialties in the allied health profession, and they take care of our patients. But I think with the training and the expertise that is given in naturopathic school, I don't support this scope of practice expansion, because I don't feel that they are capable of understanding the complications and the usage of the increased scope of practice. And I yield my time. Thank you.
Thank you. Let's see, if Amanda Marley, if you're still here, would you please raise your hand and we can unmute you? Thank you.
Hi there, can you hear me?
We can.
Hi. Well, I am also a layperson. I am an observer. I'm a current student of nursing. I have my BA in anthropology with a minor in forensics from UW. I've worked for the government for wraparound social services for the last 8 years. I've also worked overseas in a third world country for the US Embassy and volunteered, excuse me, volunteered at a day orphanage in their health ward. The rigidity of the traditional healthcare that we see today can be damaging. I am in support of this. Let's be clear, if naturopaths have the opportunity to practice wraparound and streamlined care, patient wait times would be reduced, mental health care would increase, and communication and teamwork within the relationship between traditional healthcare providers and alternative healthcare providers would increase. If there is a concern in education, it seems like that this is a what comes first situation, the egg or the chicken. Let's allow this process to unfold, this natural evolution of healthcare. Additional reach for naturopaths and additional training and education, if it is needed, let's allow for it. Excuse me, I am getting over a sinus infection. We can spend all day comparing numbers of training hours, as well as going on a witch hunt for who caused the opioid epidemic, who causes abortions. And let's be clear, it's a fact that naturopaths spend more time with their patients, looking outside the box for creative care that the patients are desperately seeking themselves. Please don't be persuaded by the opinions of folks as cold, hard facts. Naturopaths aren't folks that practice medicine under a full moon in the forest in secrecy. These are professional, well-educated, heavily trained in the real world individuals who care deeply for their patients. Let's offer care for their patients in a way that will provide long-term health benefits. There's no agenda, there's no incentivization here other than to provide education and additional care for their patients that will be long-term. Let's not lobotomize naturopaths and their care. Let's allow them to do their job. They care for their patients. And as a nursing student looking into this as a career, it's a very damaging knowing that this is a hindrance that is ongoing. Let's let them spread their wings. Let's let them do what they do.
Thank you. So that is everyone on the list that I had. I know that folks may have still signed up this morning to speak. So we do have a little bit of time. Did we miss anyone that was signed up to speak? Especially anybody this morning that we didn't have on the list? If so, please raise your hand. No? Is there anyone who had marked unsure that would like to speak? Keeping in mind, raise your hands. First come, first serve in the time that we have left. Okay. I think we've caught everybody. So let's let folks go a little early, I'll just talk a little bit really quickly about next steps to wrap this up, so you're aware. So next step in the process is we will draft, we'll have a draft report available probably late May to early June, and we will send that out to everyone who participated and give folks and everybody that's on our Grab deliveries too, to give folks a chance to have final comments on the process. Then we will consider those additional comments, determine if the report needs to be revised at all, and then we will start it through our approval process, which is an internal agency process. After the Secretary of Health approves it, it has to go out to the Office of Financial Management for review. And then we send it to the legislature before next session, so before January. And once that happens, we will post everything on our website so everyone can see the final report, and we'll also send out a notice. The recording today, we will get that posted to our website in the next, sometime early next week, and we will send a follow-up email to everyone who participated so that you're aware of the recording and where you can find it. And otherwise, if you have other questions, please continue to use the sunrise@doh.wa.gov email box, and we will answer questions to the best of our ability. Megan, do you have anything to add?
No, just really appreciate everyone participating today.
Yes, thank you. And thank you for the timeliness of the comments. It went really smoothly and we really appreciate that. Thank you. Have a good day.